Private hospitals have come under fire for charging people exorbitant prices. This happened on the second day of public hearings of the Competition Commission's market inquiry into the private health sector in Pretoria.
Day 2 of the public hearings, and the civil society organization Section 27 took the stand. It railed against the Health Professions Council of South Africa, accusing the statutory body of failing to regulate hospitals properly and also failing to take up complaints against doctors and nurses speedily. Section 27 also bemoaned the spiraling cost of private healthcare, saying medical inflation in the country has been rising far above the consumer price index for the past 15 years.
Providers of private healthcare have to relook at their business models. At the moment, it's a quick buck for many of them, a quick buck for the hospitals. They get a lot of money, they ship it out of the country.
The Minister of Health, Dr. Aaron Motsoaledi, was back in attendance today following proceedings with keen interest. He concurs with Section 27 about the ever-rising cost of private healthcare and says it poses a threat to the entire healthcare system in the country.
In 2002, the total expenditure of private healthcare was 42 billion. In 2014, it was 140 billion. It increased by more than 300% in a decade. And if it goes like that, in another decade, it will be $500 billion. Nobody is asking a question about that. You're asking a question about NHI, which is still coming. Not about the system that you are faced with, which is escalating right in front of your eyes. And that system is saving only 16% of the population.
The Treatment Action Campaign also came to testify. It says crucial HIV/AIDS medicines are still not accessible to most people in the country.
If you largely look at the people that with medical aid today, I'm one of those people who have a medical aid but still cannot able to afford the healthcare services because of its pricing is way too high, and sometimes we're even paying for things that we do not even know what are we paying for. So those are the things that we are actually coming here to present into this commission.
COSATU was scheduled to testify today but asked to postpone its presentation to tomorrow so as not to overshadow the Treatment Action Campaign and Section 27's message to the inquiry. Mbongini Muchwa, SABC News, Pretoria.